I'd like to open the discussion between the panel members first, but I want to remind the over 80 people that are joining by webcast that you can also submit questions too for the panelists here and also later in the day. Do any of the panelists want to comment on what any of the other panelists have said? No? I have a couple of questions then, maybe to start things going while people head up toward the microphones. Greg, you drew the distinction between data and information and mentioned this working group that recently met. I wonder if you can put some color commentary on the nature of the discussions that this working group is doing, and if they have any goals or objectives or even a schedule for any kind of a statement of best practices or policy, et cetera, that might emerge from that.
Well, as I said, this is something we're only beginning to grapple with, and I think to characterize the first meeting, it was trying to speak the common language. Lynn did us all a good service by providing some definitions earlier today, and I think actually as we were talking about it, some of the folks on the phone were, well, why is this even an issue? I don't understand this. So the first meeting was really to get grounded, and then as we started to talk more about it, we tried to identify things that we could say positively, things that we are doing and that we believe in. So for example, the statement I made about, we do believe that health and environmental information on our products that's sufficient or adequate to protect people should be made publicly accessible. And that's a point in which you can start. But there's more work that this group has to do. Some of the questions that have been raised here by previous speakers and by the panel here were very much on this group's mind. I think at the end of the day, I mean, I hate to kind of forecast, and I can't certainly speak for the group, but I think at the end of the day, there'll still be a large amount of case-by-case decision-making that will have to be made, but making blanket statements is very, very difficult in this area. So a lot of it, maybe it's a set of principles that would guide case-by-case decision-making.
A very good cautionary note there. John, I have a question for you. I appreciated your 6 points very much. You mentioned the one that really intrigued me was the idea of hosting data sets in, I think your phrase was, secure enclaves for analysis that would provide protections and so on. Is there an example or a model that you have in mind from some other realm that you could identify for us? I personally have not come across this approach.
Right, and we do have a pioneering model that we're trying out now with regard to this issue. So there is not a lot written or practiced in this area. So it comes about in trying to be able to make data available at the same time balancing the sensitivity of the confidentiality issues. I can't say that from our perspective, from the government perspective, that it's working. I think I'd have to have somebody on the panel who is trying to work within what we've set up. It's fairly new. It comes from a very large study that reanalysis is a significant interest on the part of many people. So we're probably not at the stage where I could report that it's entirely worked out. That remains to be seen. But I think it's one avenue that we're pursuing in order to promote the interests of data seekers in reanalysis of our data. I think as Greg was talking about, we're way beyond accessibility of data. We do that. We publish our study. Now we have people saying, really? That's the answer you came up with? And they want to look again at the data to verify for themselves that's the answer. So we're in a different place than the industry accessibility of data issue. We're trying to figure out how to make it accessible while maintaining as Kevin talks about, a shred of privacy, not just personal privacy, but also trade secret issues and several other avenues of privacy.
I would actually like to build on one thing that was just stated, that in our experience, it's not only it's been published and it's really is the response. The original publication was 1993, and there continues to be sort of a fetish about reanalyzing that initial base of data when there have been over 20 studies done over the next 20 years by international and national groups that have come to similar conclusions, and therefore, and have drawn upon different sets of participants in the groups, and to continually go back to the 1993 data and those data sets is as if science is frozen at 2 decades ago. So it's building upon your point.
Right, and I think that goes to the issue about, are we in a reverberating circuit, or are we adding to it? And certainly, you know, from the science perspective, we want people to continue to look at data with new data in mind and come to different conclusions. So it's a living, organic piece of knowledge. So that's why I think, from a policy perspective, you know, we promote and are trying to figure out a way to enable reanalysis. And hopefully studies won't be looked at of the data 20 years from now without taking into consideration new data sets that have enriched the original data set.
I have a follow-up question for you, John, but I'm going to look at the co-chairs of the roundtable. I assume there'll be a publication that'll result from this event. So I dare say, at the time that the publication is nearly done, if there's more that you can say in a letter to the roundtable about your initiative, I think that would be a very valuable addition to the report.
We'd have much more experience, and also the individuals who are on the other end of the enclave would be able to contribute their views to us.
Okay, I'd like to open the floor to questions. I think I'll alternate from one side of the room to the other, and then if any questions come in from the webinar, I'll feed those in as they appear before me. Let's start over here.
Alan Morrison, George Washington University. I'd like to ask Mr. Bond a question about your disclosures to agencies. I didn't hear you say anything about confidential business information, not only as it's supplied to the agency, but as it's available to outsiders who may take a different view about the studies. And how is that consistent with the data sharing policy, which I heard you say was very important to you and your industry?
Well, I think I tried to emphasize, first of all, the distinction between information and data. Information at a higher level than raw data. Certainly, we believe that information should be publicly accessible that is sufficient for people to take action. For years, product labels and material safety data sheets have summary information enough to provide people steps they should take to protect themselves. That kind of information, we believe, you know, we need to improve even the quality and quantity of that information, but that's information as opposed to the underlying data that information was based on. I'm looking at you to get an acknowledgement. Do you understand the distinction I'm trying?
I understand that, but if the question is the analogy to reanalysis, if somebody wants to question the conclusions you reached in a study, for example, that you submit in support of or opposition to a rule that the EPA is going to put out, information of the kind you talked about is not sufficient.
Yeah, well, the data is available to the agency, and it's up to the agency to, I mean, there is a time limit on how long we can keep this information business confidential, toxicology data in particular. But you know, beyond that, it is available. It can be available. In my experience, we had very few. I can't even think of an instance where somebody came and said, "Give me the data for the toxicology study you did on this particular material." So it hasn't been an issue that we've had to deal with very often. I'll also say just the types of toxicology data I'm talking about are done under OECD guideline studies. So the methods are prescribed for us, and the raw data that's generated, as I said, EPA comes in, can audit, they do audit, they go back, look at the their own pathologists, or they can have their own pathologists reread slides or take different sections of a tissue. All that's available.
I'll turn to this side of the room.
John Gardenier. I'm retired from the confidentiality staff at the National Center for Health Statistics, and I have a very specific question for Daniel Barth Jones. I very much appreciated your pointing out that the results of a re-identification attempt are always uncertain if you're doing it in a probabilistic way, which they generally are. My question is, we can all hypothesize the theoretical or hypothetical harms that could come from a false positive re-identification, but I don't know of any specific study that's been done in which anybody has documented an actual case of actual harm as an example of what the real societal risk is. Can you comment on that?
I'm also unaware of a demonstration of actual harm with regard to re-identification. I think our evidence base at this point is fairly slim, and one of the things I would try and argue for is doing more systematic studies where we actually do good sampling and then look at how many people can be re-identified. And then I think we're up to the point of having to make some subjective assessments of the sensitivity of the information that may be revealed and whether it could lead to potential harms. But I'm unaware of actual demonstrations of harm through re-identification.
I'll turn to this side of the room.
My name is Stacy Allen from the Committee on Science, Space, and Technology. And I just had a question about participants. So I've heard a lot about the importance of sharing data for researchers and for the federal agency. But in terms of the participants, wouldn't the participants be a little bit more comfortable with the transparency early on, knowing that their information could potentially be used by the federal government for regulation? Or is there that big of a risk that you will lose so many participants that you won't have enough for your research studies?
Well, I think that that is actually the balance that people are trying to strike, which is what kind of chilling effect would it have on people who would enroll in a study that would take their personal information and study them over many, many years if they knew that their personal information might become part of the public discourse record. Individual information, not aggregated, not collected and shared in terms of overall studies. And I think we haven't confronted that yet, but I suspect that that would have a actual damaging impact on the ability to enroll people, not only in this kind of study, but potentially downstream in other kinds of clinical trials and other areas where things could become controversial in drugs and other kinds of stuff in addition to clean air. I mean, I'm talking about clean air right now, but there certainly are other realms where there can be controversy about studies.
I was going to ask Kevin, you know, it would seem to me that we're at a stage of developing obligation on the part of scientists that whether they know or perhaps they should know that the situation of making those kinds of promises to a potential study participant in 2014 versus 1970 really isn't the reality of the world we live in. And it would seem to me, based on the last questioner's question, that there's an education process that would have to occur that I'm not sure is occurring. I know in my institute there definitely is, but I don't know whether it's a broad educational experience for scientists to be able to make the appropriate promise to a potential study participant, given the situations that we have all experienced in the last 10 or 15 years.
I think my response is that that's a really great question, and I think I'm hopeful, one of my reasons for participating today is to hope that this starts a conversation to think about that, not only in the area that specific area that I was talking about, but when we think about genomics and other personalized medicine and other kinds of areas where this is actually directly confronting us. I think that it's a really, and also in other realms like the NSA and other issues, it's before us, and I suspect that it's something that we need to come together as a community and think about in terms of enrolling people going forward.
So I hope that the roundtable considers the impact on research-informed consent from a lot of the things that we're talking about.
If I may, just another comment to that question. Based on my prior service on the executive committee for an IRB at a major medical research institution in years past, which did a whole range of types of studies, all the way from clinical trials all the way up through epidemiological and behavioral ones. Recruitment of participants in research projects was always a problem, but it never seemed to be due to the potential. In that case, the language in the consent was usually, this information will be kept silent unless it's requested by a court of law or something to that effect. That did not seem to be a reason for people not being willing to join research studies. We're back to this side of the room now.
Okay, hi. Latanya Sweeney at Harvard University. I we'll have the opportunity at the last panel to address a lot of the modern thinking and tentacles that go forward. What the group is facing is a very difficult time and situation, and I was particularly taken by Daniel Barth Jones' presentation, which not only was rooted in a 1997 kind of world, but also was horribly distorting. So I'm honored that I was cited so much. I'm horrified that the work was so distorted. And so I just want to ask two questions, and I will wait until the other times where I can tie the work more to the other tentacles here. The first one is, in one of the early slides, you showed two of my statistics on re-identification results based on demographics, 87% and 27%. Both of them had question marks. And you put them as if they both talked about the same thing. And the implication being that, well, we don't really know how many people are at risk of re-identification, and these estimates are wildly different. When in reality, Julia Brody in the second panel actually told you, in a way, what was the difference. But do you know the difference?
Sure. In the first situation, you went up against the census data, and so you created one estimate. That was then replicated by Felipe Golay for 1990 and 2000, and then I've also replicated it for 2010. Those estimates are consistently within a few points, roughly around 60 to 63%. And so I think that's a pretty good estimate of how many people are probably unique on the basis of those factors in the U.S. population. I think that's fairly close. The final estimate involves trying to match up and verify. And in that situation, you did match and verify, and you were able to verify 27%. And so I think that's an important consideration that also needs to be accounted for, is the reality of assuming a perfect population register, which is done in the first three estimates, your 87% and Golay's to 63, roughly 62, 63%. That's assuming that you've got a perfect population register. You then used an imperfect population register, and you were able to get roughly about a third. And I think that's a real-world situation, and therefore important to consider.
So that's actually not what those numbers mean at all. What the numbers actually mean is that Golay and I use two different models, and now I've introduced a new model that's coming out as well that tries to use aggregate data to calculate what that number might be. In the world today, though, we actually use public records companies, and we can actually compute with much more accuracy what that number is, and that's why the new model that hasn't come out. But what the 27% was the Personal Genome Project, a group that, as Julia pointed out, is a highly selected different group. The other thing that was really different about them is that they move. They're an upwardly mobile group, and the zip code at which many of them gave was a zip code in time, not the zip code that they were currently located. And so it reminds us of the temporal nature of the data. And it had nothing to do with the things that you said. It just had to do with the choice, the idiosyncrasies of an upwardly mobile group that tends to live in like college communities where they're homogeneous and therefore less uniquely identified, as was pointed out in the 87% paper, that many of these communities exist. My second question to you was, you pointed out the Statistical Working Paper 22, you held it up as a wonderful example of a tremendous amount of great work that's been done about strategies, statistical approaches to data redaction and ways to provide privacy. Then you hold up k-anonymity. In Statistical Working Paper 22, there are at least 40 different models. Is any one of them the perfect one that should be used in all cases?
No.
Right, and neither is k-anonymity. Do you know what its proper use is?
That's merely my point, is that...
Well, no, I think your point was it was useful in none. But do you know what use it is good for?
I'm sorry?
Do you know what a use it is appropriate for?
I'm missing the point of your question.
Do you know what... So if you gave me swapping any of the 40 things in Statistical Working Paper 22, we could give you an example of when in a data set that particular technique is appropriate or not appropriate.
I mean, I hate to butt in, but as the vice chair of the roundtable, I have to say we're getting into a level of discussion when we start talking about things like k-anonymity, losing a lot of the people, and maybe because we do have lunch after this, there's the other time the two of you can discuss that, but I think that we've hit a point where for many of the people in the audience, this is over our heads. I'll count myself among those.
Okay,
I apologize.
and a little off point, I agree.
Okay, I'll turn back to this side of the room.
Okay, I'll go for a much gentler statement. I think when we're talking about re-identification and the statistics of it, we're asking only one of the questions, and that is randomly among this great data set, would it be possible for us to identify one person? I think another model that exists out there is, if I know an individual, can I go to this data set and find out if that individual is in the data set? I can well imagine in environmental health studies that somebody is a plaintiff concerning a certain exposure. The opposing lawyer will want to search the local study that was done and find out if the data set there reveals more information than they already have. So that's a different statistical question than the one that has been asked here.
You know, I can also add another example. For us in occupational health studies, the employer may be looking for their employees amongst the data set that we have to find out what is going on with that employee vis-a-vis a disease. So that's another example.
Right. I agree with that. The second point that I'd like to make is we've talked in terms of stakeholders of data with those who are the federal agencies with regulatory responsibilities. We've talked about industry that supply data. Another place where we have a lot of public health data that is used in environmental health studies but is not generally available are data that are retained at the state government level. Data from the state health departments for which the standard response when asked is always, HIPAA doesn't allow us to reveal that even if we give you de-identified data. There have to be some new mechanisms to make that type of data available in a non-regulatory environment. Thank you.
Okay, I have what's billed as a question, but it's really a statement, and I assume that the person who raised it online would like any comments from the panel on this. I would like to note that there are examples of harms from re-identification, though the ones I point out are in company data sets. AOL released over 600,000 search records, and the search records of one woman were identified. In addition to the re-identification, 2 people were fired and 1 person resigned. A re-identification study on the data from Netflix resulted in a lawsuit. I'm not familiar with any of these particular examples. I don't know if any members on the panel are or not.
I'm familiar with both of them, and I would comment that in both of those examples, the data was not, I think, what we would call de-identified by any meaningful standard. The search terms that were in this woman's search, who was identified by the media, had not been cleansed of things that would have been re-identifying. And in Netflix, there was a presumption of very specific dates that would be available. And I think that needs to be questioned. The presence of dates in HIPAA have to be excluded unless it comes under the expert determination.
Thank you for that.
I wanted to tie that issue. I wasn't sure about the question or the statement from online, but what's interesting to me, and the gentleman here in the front row talked about actual harms, and I think you answered that. You know, the harm, there is a harm, although we probably wouldn't think of it as it depends on how you define actual, but there is a breach of promise of confidentiality that can occur that may not be a harm, a physical harm in that sense, or being fired or whatever, but that is a harm. If you promise a confidentiality and you breach that promise, that's a harm. So I think when we talk about the harms that could occur, the mere breach is the first step in that harm category.
I think that's a really reasonable point, and it kind of brings up another situation with regard to the Personal Genome Project re-identification. Even though there was no promise of confidentiality in that situation, many of the people who were re-identified in that situation without having been consulted first seemed to express displeasure. There's a fairly extensive online seminar that was done by the Harvard Law Bill of Health website, and it's a seminar or symposium on re-identification risk and ethics in science. And I'd refer you to that because I think there was a lot of great discussion that went on as part of that.
Okay, I think we're back to this side of the room.
Yeah, I think I was next, although the other side. So anyway, you know, a couple of points, and the first about harm. The case that I mentioned of Dr. Landfear's systematic review of lead and IQ, arguably there was harm in that he signed data sharing agreements, data transfer agreements with about a dozen other investigators, promised he wouldn't share their data. Because EPA had funded his systematic review, the decision was made that indeed it had to be shared. And without their consent, the data were simply made public to anybody who wants to use them, not in a secure enclave, not with any particular process that, you know, there they were. And my guess is that he repaired the relationships with those other investigators and that they're okay, but that there are people around the world who may feel cautious about collaborating with U.S. scientists in any setting where they might be asked to do a data sharing agreement, knowing that if the federal government is funding it, that their data then may become just available freely. I don't think that this is helpful in terms of generating goodwill about scientific collaboration and cooperation among countries, or for that matter, eagerness for participation in systematic review. So I feel that is a harm, to be honest. Another point I wanted to make in terms of what Greg Bond had to say. So, you know, at one time I was an assistant administrator at EPA, and I was in charge of the office that regulates chemicals and pesticides. And the pesticide office does receive these GLP type data following the OECD protocols, but does receive all of the raw data and does reanalyze them, and every time. And there actually are things that are interesting that pop out of that. And what it has to do with sometimes are observations that are kind of recorded, you know, in the margins about things that are going on with the animals that then have led them to new discoveries about some toxicities. I remember in particular one when I was there, vinclozolin where, you know, the OECD protocol wasn't looking for anti-androgen effects, but the observations that were recorded indicated the potential for that, leading to laboratory investigations that were quite different than the OECD studies. And none of that would have been detected if the EPA scientists hadn't been looking for the raw data, because, of course, the contract lab for the company wasn't looking for things like that. And, you know, if EPA had only had the data summaries, none of that would have been discovered. And so arguably there'd be a benefit for the science community to be able to see all of that, as well as to be able to use the raw data in meta-analysis, because sometimes, you know, the way things are calculated in a meta-analysis, one might want to do a different kind of model, you know, to develop a benchmark dose or something like that, and you can't do that without having the data to model. And at the same time, I think everything Greg said is absolutely true about the legal framework under which these things are done, the competition that the industry is in, and the fact that these studies are an enormous investment for licensing a product. And so, I mean, here we have, I think this is a very interesting problem that it's a nut that needs to be cracked, because there is a lot of important information that's embedded in those data.
And thanks. I agree. I don't have the. My only point was the way it is set up today. There's commercial value, and if the decision is to change that, then we'll have to adapt. But that's the way it is.
Okay. To this side of the room.
Türkan Gardiner from Pragmatica. My question relates to observational studies and of incidences of morbidity where prior consent is not required. Recently, we heard reports of association studies between peak heat surges in specific cities and elevated air quality indices, where 911 calls or hospital records, the number of hospital incidences were recorded. What if the researchers interested in the age of the patients or any vulnerabilities that the patients might have? I would like to know if there is any protocol or post-informed consent, for example, for patients when they are being followed up, or are they followed up at all?
Please do, Ellen. I have some guesses, but no knowledge, and I guess the panelists don't even have guesses.
We've been involved in such studies, and it's a tremendous challenge to obtain that, particularly if you're doing environmental epidemiology in a very mobile population. It's not just the wealthy college students who move around a lot. The population of Baltimore moves around a lot, too. So depending upon recontacting people is a tremendous challenge. And of course, that's why, number one, you may try to anticipate everything you want to do. But I can tell you my IRB at Hopkins is much less inclined to give sort of blanket approvals of, we may use the serum for a whole range of things we haven't thought of, but it will be related to health. They will not approve that anymore. And so this is very difficult. And if I may just say, Glenn, I'm absolutely surprised. If I told anybody in the studies we do with Native Americans, people in the Amazon, people in inner city Baltimore, and workers in South Carolina, that the data might become available through a lawsuit, they would not participate.
Thank you.
Linda Birnbaum. I kind of want to bring up 2 points. One, and Greg, I think both of them have to do a little bit with you. First of all, I don't think we can begin to require full disclosure of all the data and the underlying data so that people have the opportunities for reanalysis, hopefully in a secure kind of setting, with human data, unless we require the same thing from all the toxicology data. I think Lynn made the point very well. One of the problems that EPA is dealing with right now, I've been told, related to REACH, which is generating lots of they don't have the data. All they have are robust summaries, and they cannot regulate on the basis of robust summaries. I also think that one of the problems just recently that we've gone through in this country was with the chemical spill in West Virginia, which led to a great deal of concern. The MSDS sheets didn't have all the information that people needed or wanted, and I think it's inadequate today to say that's all that we need. So I understand some of the, I may not fully understand, but I think I understand some of the, you know, industrial concerns and CBI and all that kind of thing, but we have to get past that and realize that people are entitled to know what's in their products, you know, or what spills into their rivers.
Yeah, and I think there are probably ways of finding common ground. I don't know that it's divulging everything, but trying to find the balance. And as I just said, you know, we're focused more, I would say, historically on sharing information. And I said, acknowledge that material safety data sheets and labels need improvement, for sure. I mean, this is not just the only example. I can look at MSDSs across the world. I don't know if the answer is the EU version of a MSDS now, which is averaging about 130 pages, but somewhere in between.
Okay. Dan?
Dan Greenbaum from the Health Effects Institute. The whole day has already been very, very useful, I think. Just wanted to follow up a little bit on the issue of the secure facility kind of idea. First of all, that idea is not sort of radically new. When we did the reanalysis of the Harvard Six Cities study and the ACS study, that's what we created. Our investigator created one. We had to sign data use agreements and all of the other stuff on pain of death. And that's the only way that Harvard, for example, would provide the data because of the commitments they had made. But secondly, and this is the place that I agree with John that the example he's thinking of is not quite there yet because it's just starting. But the research data centers, which NCHS runs in Hyattsville, Maryland, are set up. Investigators do go in, they get access to NHINS data and other stuff that isn't just generally available. And they're secure facilities, and you do your analyses there. You get there's certain statistical packages you can use. You can't take the data set back out, but there is a mechanism for doing it in the federal government. How well that will work with every single study that the federal government has funded is, I think, is where we're still in the pilot stages of figuring that out. But.
Thank you for that. You learn something every day if you're not careful. On this side of the room?
Al McGartland from EPA. I too wanted to point out that NCHS and some people from NCHS are here have protocols and procedures for protecting the identity and data. But second, sort of an extension of that, and sort of in this rapidly moving world towards big data, I think we're going to rapidly be upon a time when we don't have to do the Harvard Six Cities study with enlisting volunteers, but that data may in fact be available, whether it be emergency room visits or pharmaceutical purchases, which you can already buy data for, et cetera, and you overlay that with environmental quality data, et cetera. But it just seems to me that there's going to be a need for a protocol and a policy on all these issues as we go forward in the age of big data as well.
Okay, I think my colleague Alma Gartland has offered a segue to the first session after lunch, which is Ways Forward. I believe there's no other questions or comments that have come in online. There's nobody standing at the microphones, and I know we are standing in the way of your lunch. Somebody is about to tell you about lunch.